Physiologic monitoring of surgical patients. Physiologic monitoring in surgical patients is a critical component of perioperative care, aimed at ensuring patient safety, detecting complications early, and optimizing outcomes. This involves continuous or intermittent assessment of vital functions and parameters to guide anesthesia, surgery, and postoperative care. 1. Purpose of physiologic monitoring. Early detection of complications. Monitor for hemodynamic instability, hypoxia, or arrhythmias. Guidance for anesthesia, adjusting anesthetic depth and medications based on real-time feedback. Optimization of physiologic parameters, ensuring adequate oxygenation, perfusion, and homeostasis. Documentation, providing a record for postoperative analysis and medico-legal purposes. 2. Parameters monitored. A. Cardiovascular monitoring. 1. Heart rate, HR, and rhythm, detected using electrocardiogram ECG leads. Abnormal rhythms such as atrial fibrillation or ventricular tachycardia are noted. 2. Blood pressure, non-invasive, using a cuff with oscillometric devices. Invasive, via an arterial catheter for real-time monitoring, especially in critical surgeries. Central venous pressure, CVP, measured using a central venous catheter, helps assess fluid status and right heart function. 4. Cardiac output, CO, measured with techniques like thermodilution or pulse contour analysis, provides insight into cardiac performance and tissue perfusion. B. Respiratory monitoring. 1. Oxygenation. Pulse oximetry measures arterial oxygen saturation, SpO2. Arterial blood gas, ABG, analysis for PaO2 and oxygen content. 2. Ventilation. End-tidal CO2, ETO2 monitoring reflects alveolar ventilation and CO2 elimination. Capnography provides a waveform and numeric value. 3. Lung mechanics. Measurement of tidal volume, respiratory rate, and airway pressures in mechanically ventilated patients. C. Neurological monitoring. 1. Depth of anesthesia. Bispectral index, BS, or other EEG-based monitors assess brain activity to prevent under or oversedation. 2. Cerebral oxygenation. Near-infrared spectroscopy, NIRS, monitors regional cerebral oxygen saturation, particularly in neuro or cardiac surgeries. 3. Intraoperative neurophysiologic monitoring. Techniques like somatosensory evoked potentials, SSEPs, or motor evoked potentials, MEPs, monitor spinal cord and nerve integrity. D. Renal and fluid monitoring. 1. Urine output, indicator of renal perfusion and fluid balance, typically measured via a Foley catheter. 2. Electrolytes and acid-base status. ABG and serum electrolytes provide information on metabolic status and the effects of interventions. 3. Invasive monitoring of renal function. For high-risk cases, parameters like renal blood flow or creatinine clearance may be assessed. E. Temperature monitoring. Core temperature is monitored using esophageal, nasopharyngeal, or bladder probes. Hypothermia or hyperthermia is managed actively, as both can have significant impacts on patient outcomes. 3. Monitoring modalities, basic monitoring, vital signs, HR, BP, SpO2, respiratory rate, temperature, ECG, and pulse oximetry. Advanced monitoring, invasive BP, CVP, pulmonary artery catheterization. Advanced imaging, e.g. transesophageal echocardiography, TEE. Specialized monitors for specific surgeries. Continuous versus intermittent monitoring. Continuous monitoring for high-risk cases. Intermittent checks in stable, low-risk patients. 4. Perioperative phases. Preoperative monitoring. Baseline assessments, including blood pressure, oxygenation, and laboratory values. Intraoperative monitoring. Real-time assessments of critical parameters tailored to the procedure. Postoperative monitoring. Close observation in the recovery room or ICU for early detection of complications. 5. Challenges in monitoring. Artifact and noise. False alarms due to patient movement or equipment issues. Interpretation of data requires skilled personnel to differentiate normal variations from pathology. Resource constraints, limited availability of advanced monitoring in low-resource settings. 6. Future directions. Wearable devices allow continuous, non-invasive monitoring. Artificial intelligence, AI, predictive analytics to anticipate complications. Integrated systems. Seamless data collection and interpretation across perioperative phases. Effective physiologic monitoring enhances the safety and success of surgical interventions by enabling real-time decision-making and prompt intervention.